I remember first hearing about motivational interviewing back in the late 1980s when I was at Jefferson Medical College in Philadelphia. And all I knew at that time was just to be hounding patients about all the terrible things that might happen to them. Then I went to a 3-hour workshop on motivational interviewing, and wow, it just changed everything for me. I really looked forward to seeing these patients again. And when I did, I apologized to each about how I lectured them. And I asked them what they would like their blood pressures and blood sugars to be. And it was so amazing. So many patients had aha moments.
My name is Brenda Blank. I am a child protection ongoing supervisor in Dane County Human Services. How I came to motivational interviewing was many years ago. When I was a baby social worker, I could really use some help in interviewing skills, not really knowing what MI was. And it was so helpful being able to use those skills in real time with real people and then get that support back in the training session, I would say changed my career.
Came to motivational interviewing about a decade ago when I was working in integrated behavioral health clinic. I watched patients kind of in a standstill where they'd come back. And despite my best efforts, I didn't really see progress. And then one day I did a co-visit with a behavioral health clinician, and I watched a person that I had been working with really unfold in a matter of 5 minutes, where they opened into a completely different conversation. And at the end of that visit, the patient left feeling really empowered and hopeful and had a plan for themselves. And afterwards, I looked at that clinician. I was like, what were you doing? What is that magic that you are doing? They said, oh, this is motivational interviewing. And that was the beginning. I was like, I need to learn this.
My favorite thing about motivational interviewing is that it's, in my case, like student-centered, that we focus on whatever area of change the student wants to talk about, whatever goal you want to come in with, whatever you want to work on. That's what we're gonna focus on.
It's really about your style. It's about being in the spirit and allowing the conversation to happen, and then think about where you can instill some thoughts and ideas that might help the individual think differently about where they want to be with their health.
I think the motivational interviewing approach just helps us come across to patients as warm, empathic, and non-threatening.
When I hear staff feeling as though they're making progress in keeping families focused on an area, or like maybe they said one thing that maybe they wanted to change, like that for me is like, oh yeah, okay, this is we're on the right track.
What I've learned is it's not just a set of skills. It's really about changing a whole approach to how I interact with patients. And it's transformed my practice. And as I wish I'd come across this earlier. So it's become my passion to bring it to other people.
Remember the first time I did a double-sided reflection, and the patient actually walked into it and gave me all kinds of wonderful thoughts and content. And I was just so worried that I didn't even say it right. So that was like way cool. I'm like, whoa, that really was seamless. They didn't even notice, and they just kept on talking. And that was a really wonderful thing.
Staff really need this because they're telling us they're having problems communicating, especially during COVID. It was really apparent during COVID. How do you pick up on, some of those issues that people are having when it's over Zoom? Staff really need more motivational interviewing.
I think my favorite thing is that it really takes the pressure off professionals like me who feel like they need to fix everything, and really just being able to focus on truly knowing what's important to them, who they are, and trying to really empower them to say, like, you know what you need best. So why don't you tell me kind of what you're thinking and we can work that way, instead of me feeling like, okay, what's the solution for this client or that client, or what services do they need for this to work, and taking that pressure off.
So often when I work with new learners, commonly they'll say, when I'm saying these reflections, it feels odd to me. Usually in those instances, I encourage learners to, number one, start with a few reflections that really feel better to you, and then continue on practicing those. Like if you can have just a few tools in your box to start with, you'll gain that confidence.
Most important is just keep at it. Don't give up, and keep seeking opportunities to practice and get feedback from skilled motivational interviewers, somebody you trust and respect, to help you keep learning and growing.
I mean, the biggest advice that I feel like I give out, and I try to incorporate into other trainings besides motivational interviewing, is you don't have to feel like you need to remove barriers. Like, just leave the sustain talk where it is. When they're talking about keeping things the same and everything they like about the negative behavior or choice that they're making, like, just focus on those little tidbits of change talk. And I feel like that goes a really long way.
The key element that was missing was I was still doing that traditional, I am the expert and I will tell you what to do. And that needed to change. And it's changed in a big way. I'm retiring from clinical practice, but I'm going on to continue to train in MI. My goal is to see if I can reach people who are at early learning stages to get this, at least the spirit to them early. If this is something you want, I will tell you about it. And if you invite me in, I'm here to teach you. And so I'm looking into teaching some residents, some healthcare workers at our clinic, maybe at the hospital, veterans, people who provide care to veterans, and nursing students, and all that's very exciting to me.
The advice that I would have for them is just keep working at it, keep practicing, keep finding people to say, hey, can we talk for a few minutes? Can we try this? Almost putting ourselves outside of that comfort zone and just continuing to go back to, we're going to fail. And I don't like failing. I call them learnings, mistakes. I call them learnings. Like we're going to learn and we're going to try new things and we're going to figure it out. And sometimes it works. Sometimes it doesn't, but you're going to learn from those experiences. It's going to make you a better practitioner, a better user of motivational interviewing. And if you don't try, you don't know. So we got to give it a try. We got to try things out. Sometimes that feels uncomfortable and awkward, but that's the growth and that's how we improve.